So Rob, I get it. Envoy at home is like having your own envoy sending information from the home.
That's right, Bill. That's exactly what it does, except we didn't stop there. We really knew that there was incredible power and value in the data that Envoy at Home had. And so what we did was we connected with the University of Pennsylvania. They have a program called Pennovation. And in Pennovation, they have a program that's funded by the National Science Foundation called the I-Corps program, which helps commercialize innovation. And so we were accepted into the program, and we brought Envoy at Home into this, and we met with health policy experts, healthcare leaders, and we expanded our team to include folks who had RN degrees, PT degrees, PhDs in behavioral psychology, Masters of Public Health, and we really see this as an enormous differentiator from what we're doing. We think there's tremendous value that our clients will gain from looking at this data from the perspective of a healthcare lens.
So who would use the data?
Well, the data would be used by a variety of organizations. And so one quick story I can share was we were brought in from a company who's a home health agency. They are a part of a national, they have a franchise in Philadelphia. They own a variety of territories in the Philadelphia area. They had a very challenging client, and we were asked to come in and help them. The problem was this individual was a 64-year-old male, dementia, and he had an aide from 7:30 a.m. to 10 p.m. And so the question was, what's happening at night when he's not there? Does he need more service? The family was concerned, had safety issues, but of course it's very expensive to bring in care 24 hours. And even more importantly,
Even more expensive than a nursing home in some cases.
it can very well be, that's right. And even more importantly, in terms of living better longer, this individual would completely lose his independence. He would have no time that would be available to him. And so we placed our sensors, as I said earlier in the show. They take about an hour. We help the staff configure this all up to set up a plan to monitor him. And within the first night, and certainly by the third night, the feedback was words like, "We are astounded. We had no idea what this individual was doing at night." And as it turns out, what he was doing was he would go to bed around normal bedtime, and then he'd wander out into his apartment, which is okay, but then he started opening his front door, and he would do this on average 5 times a night.
Wow.
Now, he wasn't leaving, but over the course of a couple of weeks, this became a very clear pattern of behavior for him. And by the 4th week, it actually started leaving the home for brief periods. The home care agency and the family were able to use this data, evidence-based, data-driven, to make some decisions around finding the right place, for this individual to make sure he was safe in an environment that gave him the best possibility of living better longer.
So what I'm hearing is even if you have family involvement and home health aides, Envoy at Home is still applicable, right?
Exactly right. And so what we're finding is there's this balance between what we're calling high tech and high touch. And so there's no reason why we can't supplement what people are doing who already have home aides. And so we're working with agency providers who really see technology solutions as potentially benefiting their clients, and we're working with them to develop new business models to help them provide this to their clients. In some cases, people don't know where to start with home care, and so we can provide a way to, an on-ramp to allow families to just put this blanket of protection in so they can get an understanding of what's really happening in the home.